So we're on week 4 already. It's amazing. We're going quickly. This is a great week for you to think of your pediatric assessment diagnosis and do the paper to start with, okay? As quick as you get them done, I'll get them read. I believe I have one already that I need to read, which I'll be doing this week, getting that back to that person. Week 4 is a little bit of everything. It's impact of cognitive and sensory impairment. It's about family-centered care and then kids during hospitalization. And then those variations between adult and children. And there are quite a few that we're going to be talking about. Now, I told you, you have a choice. You want to do a PowerPoint, it's 80 some odd slides, but I'll go through it quickly, hitting key concepts, or we can do a Kahoots. It's up to you. Is everybody okay with that? Thumbs up?
You're
There we go. Not a problem. I know you all like them, and I know you like the way I talk over them. So here we go. So remember with that pediatric assessment assignment, please send me your diagnosis. Let me confirm what it is before you start. Who's going to win today? Faith, are you going to win? Maybe. How
heck
about you,
no, Faith
Olivia?
ain't gonna win. Look at her. Just look at her.
You never know. Olivia, how about you? You want to win today? There you go. Positivity. It all starts with a good mental attitude. When you feel you'll do well, you will. All right, guys, let's get going.
Miss Bogart,
Yes.
I had sent you an email about the project about what I
Oh,
was gonna do.
hold on a second, William.
Okay.
Early detection of a hearing impairment is critical. Which one is of primary importance? So, when you're thinking about hearing, what does hearing affect? Remember, one system affects another one, right? If you can imagine, if you are not hearing correctly, you don't hear other people, right? And the problem is it's all about speech. So hearing, you see a problem, the thing you need to do is say, doctor, this child doesn't hear well. They're not speaking well, they're not pronunciating. Let's check hearing. That's the first thing you would do. Yes, William. I believe I okayed yours already.
Okay, thank you.
No, you're welcome. A multi. Toddler playing outside gets a laceration on the forearm and he needs stitches. Make this easier. Remember, toddlers, preschoolers, that age is all about, I'm blooding and I'm bleeding to death, and they're afraid of needles, right? So, what can we do? Well, we are never going to restrain them like in a mummy. We're going to have maybe somebody holding the arm, distracting them, and numbing cream. Now, child life is a great, great thing that all of a sudden they were in my ER, and I'm like, who are these people talking to my children? And what they do is they make it understandable on their developmental levels. These are a minimum of bachelor prepared. Many of them are masters and doctorate. And they go into the children, let them touch the end of just the catheter of a needle, not the needle inside, and see how flexible it is. Let them touch the tourniquet, the arm boards, or whatever they're going to do. Now, would you see the equipment for suturing? Oh no, that's a needle, isn't it? You would just maybe show them the little hemostats that you would use, but not the needle. So that's partial correct there. The parent recognizes that her toddler has a speech delay compared to the older siblings. What's your priority when you hear that? What's going on? What has alerted you there? Speech delay. So number one, you want to check the hearing. That's the first thing you want to check. Well, would you do speech therapy after that? Yes, but priority, which means first thing, hearing evaluation. Very good. Multi. What are signs of an early indicator of impaired cognition? That means their mind isn't working well. That means usually impaired cognition, that's that growth and development, and that's that delays that you see. Could it be due to hearing? Could it be due to, they were premature, maybe Downs? Any of those things could have the impaired cognition. So they should be saying one word by 1 year old. Absolutely, that's an indicator. Number two, can they grasp? Remember, there's that reflex grasp by 4 months. They should be able to do that. And then behavior difficulties and why that? If they can't speak, they can't express what's going on. So they tend to act out, get a little, crazy, trying to say, they're frustrated. They can't tell you what's happening. So that's why those behavior difficulties. Because if they can show you, they can tell you, then they're not going to have that. The child's being treated for a fever. The reason for treating the child's fever is what? And be careful with this one. How do you feel when you have a fever? I know I have a fever. I don't want to lift my head up, do I? So it is only for the relief of discomfort. Now you're saying, why not life-threatening complications? Once you have a fever, the chances of seizures or life-threatening complications decreases incredibly, okay? It is when you have no fever and 30 minutes later you're 102. It's the rate of rise which sparks the brain, which causes it to have a seizure, okay? Those are called febrile seizures. But a kid who has a fever sits in the corner and doesn't eat. How do you treat a fever? Antipyretics, fluids. A kid who has a fever don't want to eat nothing. That fever comes down and the kid's running around drinking and eating. That's why we treat the fever. A multi. A child complains that something is in their eye and it's causing tearing and pain. What would you do? It's like, oh, it hurts. It hurts. And there's just tearing like crazy. Something's in there. Well, the book says anything floating, you take a piece of tissue and you can get out that little thing there. Now, another thing is if there is a penetrating object in there, you are to leave it alone and you are to put what's called a fox shield. And what that is a hard shield. It's not like a nice gauze, which will touch that. It sort of makes a thing so that the eye can be there with nothing touching that penetrating object. And then the other thing is let's check those eyes for reaction to light. If there's no reaction, that is a big problem. Again, should be going to treatment, an ophthalmologist or pediatric ER that has eye physicians. Separation anxiety in a child hospitalized. Which behavior indicates the stage of despair? Now, in the book, goes over separation anxiety, really important concept. What happens when you leave a toddler at inside a hospital? Mom has to go home. They scream and yell, right? And then all of a sudden they just, all right, they're not coming, start sucking their thumb again. And then the third part is despair. It's they just this regression, which means mom comes, they're not gonna want to, you know, go with them, and they're going to ignore them at first. So 3 stages: separation anxiety. The second one is all of a sudden they're sucking their thumb, or they want a sippy cup when they're on a regular cup. They regress in behaviors. They could become incontinent if they're already potty trained. That is what we see with it: screaming and yelling, regressing, and then ignoring parents. 3 stages. A child with a history of abuse, which therapy explores emotional problems. This is a lot done with child life or a psychologist, and it does work well because toys are not threatening, are they? And the way they play with them tells us a story. And it's called just simply play therapy. Let them play. If it's something sexual, you have a male doll, a girl doll, and you have, other toys around, and let's see what happens. It will tell you what's, and especially if they're guided by that child life or psychologist, that will tell them what happened to them because they don't sometimes know how to express that. A multi. When can children react to the stress and anxiety of hospitalization? Before, during, after, when? And remember that stress and anxiety also depends on that hospitalization, doesn't it? If they were hurt, by somebody starting an IV and they couldn't get it and they weren't nice and didn't explain it, and now they're scared, that's stress that they'll always remember, right? Sometimes it's before they go in because they don't know what's going to happen, or sometimes it's after they go home and they're, reliving those experiences. They say actually the children who gets the most stress anxiety is one who's been in more than once. That could be your sickle cell child, right? The one that keeps coming in for treatment. Maybe something happened that they're remembering. A multi-select. An adolescent goes to the ER for treatment without the parents. How do you get consent for treatment? Adolescent to the ER. What do we know about consents? You'll always see on HESI and NCLEX something about consents regarding children. Now, if that 18-year-old is alert and competent, they sign their own, okay? If they come in as an emergent, let's say through trauma, you don't need a consent. 2 physician signatures suffice. And as soon as that child is stable, they can get that parental consent, okay? And also, it can be a 2 witness telephone consent, and then, of course, those emancipated minors with the papers can also. So these are things about the consent. A child is extremely fearful of hospitalization. What type of play explores these fears? And that is dramatic play because they're putting on a drama, right? Putting on a play, showing you what had gone on there. And you could say, so, where did you get afraid? Draw me a picture. Or again, toys, show me how that happened. But that is dramatic. They have a certain incident which caused them fear. When checking the IV in an infant, you notice that the tissue around the IV is swollen. What do you do first? Priority. Remember, infants, 10 mLs, 15 mLs is a lot of fluid. And then you note it's swollen. You're going to keep it running? Absolutely not. Number one, turn it off. Swollen, that needs to be DC'd, and it's going to need a new IV start. In helping a child to adapt the hospitalization experience, the best approach is, and let's think about toddlers and preschooler when we think about this. This is probably the biggest group that needs to be adapted so that they have a better hospital experience. And it's about routine. Remember toddlers, that ritualism. They want the same thing. Get up, they change their clothes, foods if you can, same foods, bath times, same times. This helps that child feel more comfortable and secure. As they get older, preschooler and school age, it's not needed as much, but it helps. It always does help. When assessing vision on a child, the healthcare provider would use a Snellen chart at what distance? Go back to your health assessment, right? And it is 20 feet. And if they can't see, right, what would you do? Let the doctor know so that they can do whatever intervention. Could be a new finding or something that you found. A multi. Nursing care of discharging a child to home. So the child's ready to go home. You've packed them up. What do you need to make sure you've done? Now, child could be a school age child. And what's wrong with giving discharge instructions to them? Nothing. Let them read it. School age children really like to know what's going on. They're the best age group actually to teach. So it's not only the parent, child too. Explain what should your child look like tomorrow, the next day, so knowing that they're progressing to getting better. Any emergency telephone numbers, and then have that parent reiterate, tell you back what they're looking for, in their child and what they need to do so that that they understand the instructions. What is a 3-year-old biggest stressor of being hospitalized? This is that toddler preschool area. What's that biggest? All of those could be it, right? But what's the biggest? And it's when the parents leave. That's that separation anxiety. Separation of parents is their biggest fear. Leave them in this big place with these people with needles that are poking and prodding them, and mommy or daddy's not there. That's their biggest fear. I'm multi. What is the best way to alleviate the stress and anxiety of a hospitalized child? So after all of those questions, it brings you down to this. What's the best way to keep that child, not having all that stress and anxiety? It's as simple as leaving the parents there, following the routine, and then always explain on their developmental level what's going on, what to expect. When they know what's going on, they're happy. And we try to keep their bed in the hospital free from pain. So no invasive procedures there. There's treatment rooms. There's other places that can be done. A nurse notes a string tied around an infant's wrist. An appropriate nursing intervention would be what? I think in South Florida, one of the things is this little eye, like this one here, but it's black. And they always either have it around the wrist, around the neck, and I had no clue what those things were. So what did I do? I said, what is that thing? I'm seeing it on many people. And what I found out, and then I had one parent give it to me, is they don't want people have bad thoughts. So it keeps the bad juju away, basically. So there are these cultural things You don't have to know it all. The best thing always is to ask, and you will get a response, and the parents will appreciate that. How can a hearing impairment develop? So we talked about hearing and speech. Well, how did the hearing get bad? It's everything, okay? It could be present at birth. Maybe you're not having an ear or a blocked canal. That could be there. Could be illnesses, there's all sorts of things that it can affect the ear. Chronic ear infections, prematurity. What about vancomycin? Those aminoglycosides, if they have to be on them. They're ototoxic, right? They could burn the ear and cause hearing impairment. So there's a lot of things that can cause it. And even sound, really loud sounds can do it. Which urine collection method on an infant is most accurate? And the key word here is most accurate. And remember, it's an infant. Infants do not have a backup to their immune system. So if you're doing a urine collection on an infant, it's probably because you think there could be a urinary tract infection. And the only way to get the most accurate is a straight catheterization. Now, I know everybody wants to do the bag, put the clean catch on them, or, those sort of things. Well, number one, how are you going to do a clean catch? Hold them up, wait till they urinate, let them urinate and grab it? No. A straight catheterization gets a best clean specimen the first time. Place them on the antibiotic and the infection will go away. If you do a bag, you're getting skin contaminants, and clean catches is for older children. Yes, we do it for the older ones, but infants, we have to be very aware of their immune system. It's not functioning yet, so we need to treat it with one time, not 2 times or 3-time antibiotics. A multi. What is the purpose and function of the family? Family-centered care, right? And I think many nurses don't go into pediatrics because they don't want to deal with families. One of the biggest things that I hear. I have many, many families that to this day I still communicate with. It's that safe environment, it's that emotional comfort and identity, and of course, it's their values, attitudes, beliefs. All of these things are what the family is all about. The primary goal in caring for the child with cognitive impairment is to what? You have a child who's delayed. This means delayed. So your goal is what? So it's to promote optimal development. So, yes, you might have a nonverbal cerebral palsy children, and you'll meet those things in some of your clinicals. Now, those children years ago, we didn't do anything for them. We didn't stimulate them. Today, I've met 6 and 7-year-olds that are learning circles and colors and words with a little pad, and we're giving them the best they can. If they can walk, we're getting them up and getting them walking. We are trying to make the best out of that child, be the best you can be. Okay? That's what that is, optimal development. Many infants require oxygen. Which type is best tolerated and accurately delivered? Many children are born with TTN, transient tachypnea of the newborn. Some of them get pneumonia, some aspirated, something, at birth, and they need oxygen. And the best thing is actually the oxy hood, that clear plastic hood, and it is completely monitored. We get a good, accurate oxygen level. And guess what? That child can look around, and that cannula, which they rip off with their hands and rip their skin off, it tickles their nose. This one's just an environment and they could put their pacifier in and be very happy. So oxyhood is the best tolerated. What is the best practice for school-age children with special needs? Special needs, they're blind, they're hard of hearing. Let's say they're in a wheelchair due to many medical conditions. It's our best practice. What we try to do if that child is cognitively alert and in that grade, and there's many like little Manuel Louis is a myelomeningeal. He does not walk, but his brain is smart. And he was integrated into regular classrooms. I met him after 14 years of not seeing him, and he had just gone to the 8th grade prom, and he was just so excited, and the mother said he was so smart. So years ago, we didn't do that. We believe today the best is to special needs, put them into regular classrooms when we can. A multi. Collecting a heel stick blood specimen on an infant. Now, only a venipuncture is needed when we want to do blood coagulopathies. Almost everything else, we can stick the heel. But how do we do it the best? I've seen such bruised up heels, and you can't imagine. It should be, first of all, you put a hospital approved heel warmer on it, warm it up. Then you hold it below the heart. I used to always sit down below them, hang over the foot. And then it's the outer aspect of the heel. You go to the middle and it's going to hit the calcaneus bone, cause osteomyelitis. Okay. And then only use that infant needle, okay, which is less than 2 millimeters, a tiny little prick, and it doesn't hurt the heel. And slowly, slowly, don't squeeze hard, and you'll have blood as much as you need. You can do a CBC and a complete blood electrolyte panel with 1.2 mLs of blood, which is hardly anything. Referrals for cognitive impairment should occur when? So the child's not turning over, it's not lifting his head, it's not grasping, not walking, not talking. When are we supposed to refer these children? And as soon as we possibly see it. What has been found is the earlier we get them into intervention, speech, physical, occupational therapy, the quicker that they catch up and they could be the most that they can be. So as soon as you recognize, get them into therapy. Down's children have frequent upper respiratory infections. Why do you think? What it is the nose is flat and mucus gets caught there and it drips on the trachea and causes that secretions to build up and that cough to go on. That's why. It's because of their nose. A multi. What would be included in the plan of care for a patient with moderate cognitive impairment? Remember, there's minimal, moderate, or, very, cognitively impaired. There's all different levels of children. And we're going to do everything. That really good structured schedule, number one. They know what's coming next. They don't like change. So that, of course, exposing them to sight, sound, sensations, toys, but remember everything in the mouth. So make sure that it's safe and then give them activities that are going to teach them something. Put this, the ball into the round hole, put the rectangle into the rectangle hole. These are things that they would do depending on the age of the child. Multi. Autistic children demonstrate which behaviors? Now, autistic children are usually not diagnosed about 2 to 3 years old. Yes, they're going to have some inkling that something could be going on, but that diagnosis doesn't usually come till that age. We know they're going to be cognitive delayed, so they're going to have language delays, right? They like to sit by themselves. They don't want other people around. They don't like loud noises. They don't like lights. They don't like to be touched. They don't like to look you in the eyes. And if they're in the corner, they are not going to respond to their name easily at all. A multi. Children with autism have better outcome if what? So many children with autism do not have any vocabulary, so they can't express themselves. So that's why they could get angry, and restless. Okay, so that routine is good. Then teach them how to communicate with you with verbal communication, or maybe it's a board with pictures on it. And just because they have autism doesn't mean they're allowed to have unacceptable behaviors. I've met this little boy, he was actually Down's autistic, believe it or not. And that child would go into his daycare, take off his backpack, put it in a cubby, sit down and wait for vital signs. He already knew the routine, he already knew what was going on. And if there was unacceptable behaviors, he was corrected, just like anyone else. And therapies could be mom and dad, sisters, brothers. Doesn't only have to be licensed. Multi. Fragile X causes. Second most common of all cognitive, delays. Downs is number one. Fragile X is two. They're similar and there's a little differences in them. So again, their intellectual disability, they're cognitively delayed with those learning difficulties, but these children are aggressive to the point where they're going to need medications to calm them down. Also, big ears, big jaw, different sort of physical stuff going on them. So that's the difference between Down's Fragile X. Down's number one, Fragile X number two. Causes of autism. And with autism, it's mostly boys. And your chances, if you have one child with autism in the family, the chances of another one are great. And if we knew what was the cause, boy, we would be curing that pretty quick, wouldn't we? Genetics, we don't know, abnormalities, hypoxemia, who knows? Um, they're still looking for the cause. Ways children with hearing impairments communicate with others. Put two children with two different languages in one room, play together, and they'll just sit there and play together like they're understanding each other, right? Well, just because you can't hear, it's the same thing. And it's going to be sign language, lip reading, finger spelling, depending as they get older and older. They find a way to communicate, and they just have to be given those tools. Here's the tools that you need in order to communicate. It could be as they're younger, a picture board telling me what you want. Amblyopia. It's an eye condition. What is amblyopia? We have farsighted, we have nearsighted, we have lazy eyes, we have cross-eyed, and then we have those eyes that one or both could be twitching all the time. Amblyopia is what we call the lazy eye. Well, how do we treat a lazy eye? Well, we have to make it not lazy. Cover the good eye, make the lazy eye work, and that strengthens the muscles of the eye and usually will correct it. Usually to the right, to the left, up or down, the eye's just not straight. That's the lazy eye. How would you help encourage a preschooler to be less apprehensive when taking their vital signs? Preschoolers are pretty smart. They adjust, they decrease stress as compared to a toddler. So after you've broken the ice, you're not threatening, they're on their developmental level, let them play with the equipment. I would always say, here's the blood pressure, because that's the one that they really get stressed on. They can push the button, do me first. Oh, my last number is a 6. What's your number going to be? And then they push it, and now they're not threatened with it. Have them helping. They will be better. What child may be more stressed when hospitalized? Is that cognitive delay? Is that high functioning child? Is it what? And it's actually the kid who's been in and out of the hospital more frequently. They have probably had a bad experience along the way, and that's what makes them more stressed. A toddler has a hard time fixating on a single point. The eyes cross midpoint, they cross eye. Which one do you think that is? And that is called strabismus when it goes past. And then the one that just tweaks a little bit and you can see it jittering, that's nystagmus. So we have amblyopia, we have strabismus, and nystagmus. Then, of course, you have the nearsighted, the farsighted also. A multi. Safety in administering medications to children include. This is one of the variations. Chapter 39, something you need to review. Bunch of different things. The difference between children and adults. Well, the number one thing is the proper dose. Always check to make sure the dose is correct. It's easy to overdose children, okay? And then we only check the name ban. The child may not know his name or give you his nickname, never a room number, because children, they're moving all the time. So only a name ban to identify and then calculating proper doses. Can help the parents to make a baby swallow their medicine. Now, how many of you have a child, you put the medicine in there and they spit it out at you? Not not uncommon at all. And the thing is, okay, so you have a child, you put the medicine in and not the whole thing at once, depending on how much it is. The side of the cheek, never squirt it in the back because they're going to vomit on you. And then you take a big breath, go, real quick, and the child will, when they swallow it, they get scared and it will get the medicine down. I have used that so much and it works, and I've taught the parents all about it, and it does work well. Treatment for amblyopia involves. That's the lazy eye. How are you going to treat it? So amblyopia has a lazy eye. You need to make it work. So cover the good eye and let that lazy eye work, strengthen the muscles. And what they'll do is they'll take off the eye patch on the good eye this many hours, and you put the patch on and off, depending on whatever the ophthalmologist tells you to do. But it's always you put it on, let it work, and you take it off and rest it and put it back on. And that does seem to work. The nurse is discussing sexuality with the parents of an adolescent with cognitive impairment. It's important to remember. So you have a 14-year-old girl. They're cognitively delayed. Could be that Down's child, right? Well, just because they have Downs doesn't mean they cannot follow directions. Giving them that well-defined concrete code of sexual conduct will let them know when somebody's touching them wrong or doing something wrong for them. It's like us telling our young kids, don't ever go in a car with a stranger, right? So same concept here. And they will, and if something happens, come back and tell me what happened. So that well-defined concrete sexual conduct is what they need. Another multi. A child's asking mom about his sibling in the hospital. So how can you alleviate his fear and the stress? You don't know how lucky we are today with FaceTime. Because how many children in the hospital, and some so really severely sick for 2, 3, 4 months. I mean, even in NICU, 6, 7, 8 months sometimes. What can you do? So sometimes get that child to do something, have them make a card, or if they're going to go in to see their brother or their sister, have them prepared. Are they intubated? Do they have IVs in them? Are they in an isolette? Are they in a crib that's whatever? Make them aware of what's going to happen so that they're not afraid when they see them. Okay? Very important. Worrying about their brothers and sisters. Another multi. What are some best practices when a child is in pain? And pain is a big thing when you see it on HESIs and NCLEXs. So I always throw some questions in here about it. So you administer the pain medicine as ordered. Don't do decreased doses if it's a proper dose, okay? Get them their pain medicine. Sometimes it's just repositioning. I had abdominal surgery. I'm laying flat. Put the head of the bed up, right? And then, of course, that distraction. Put on a video. Give them an iPad. They'll play games. They'll be happy. And then if we're doing treatments like incentive spirometry, don't do it before pain medicine is administered because you had just an appendix taken out, it's going to hurt. So do it after the pain medicine's been given. Another multi. Children can be critical ill for long periods of time. How do you prevent pressure ulcers? And yes, children can get pressure ulcers. So keep them dry, turn them, that draw sheet, because you're not shearing them up on the bed sheet, because that can take off skin. And then I've used those little beanie babies to hold up ET tubes, to hold an arm over. I've used blankets, stuffed animals, bigger ones. Keep them over on their sides. It'll help them reposition. All of these things we can do just like adults, but for children. And last question, a multi. Young children can be stressed by being in a hospital. How can you decrease the stress? So we'll never limit visitors. Good job. Same routine, parents, use toys, or maybe that special pair of jammies, whatever it is, make that child don't feel as, different and wearing those weird hospital gowns. Let's see how we did. Number 3, Elmo's World. Okay, Elmo. Somebody's exhausted. I don't blame you. You have 2 exams this week that I know of. And Petra. Good job, Petra. Amber and still mad. I'm sorry you're still mad. So that's the end of week 4. As I said, your exam grades will be out Saturday by noon. Anybody, is having a moment, let me know. If you need to get with me next week, I'll tell you, meet with me and go and review the exam. I don't care if you got a 96 or a lower grade. You want to meet with me in order to review your exam. I am open for anything. I know I'd want to know if I got a 96, what are the 2 questions I got wrong? And of course, the other way, I want to make sure that you're okay when your HESI and your NCLEX comes up, that you're understanding concepts. So this week, as I said, it's a great week for you to do your APA paper to get it done. There is a discussion question, and there's one CJ Sims on Felix. So that's all I got for you today. Good luck, and I'll see you next week, guys.